Hey everyone! Today I want to dive into some fascinating new research that could change the way we approach surgery for morbidly obese patients. A recent study published in the Journal of Bone and Joint Surgery has revealed some crucial laboratory predictors of periprosthetic joint infection, or PJI, in patients with severe obesity. Now you might be wondering, why is this important? Well, for patients with a body mass index (BMI) of 40 or higher undergoing knee or hip replacements, this research could be a game changer. Dr. Nathaniel D. Heckman and his team at the Keck School of Medicine, USC, examined a whopping 6,780 patients with morbid obesity. They used a national insurance claims database to identify preoperative lab markers that are linked to an increased risk of PJI. The findings were pretty revealing. Hemoglobin levels, platelet counts, and several markers of systemic inflammation stood out as significant predictors of PJI. Let's break this down. Patients with hemoglobin levels indicating anemia had a PJI rate of 1.69%, compared to the overall rate of 0.69%. For those with abnormal platelet counts, the rate jumped to 2.14%. But it doesn't stop there. Elevated ratios from complete blood count (CBC) tests were also linked to higher PJI risk. For example, a higher neutrophil lymphocyte ratio was associated with a 1.11% PJI rate, while an increased platelet lymphocyte ratio saw a 1.69% rate. These findings are incredibly important for surgeons. They help in risk stratifying morbidly obese patients before total joint arthroplasty, a growing high-risk group. Interestingly, the study found that anemia had an even stronger link to PJI among severely obese patients compared to the general population. This underscores the critical need to assess anemia before surgery. On the flip side, the study found that albumin and glycated hemoglobin levels were not linked to PJI risk, which contrasts with some previous reports. While these results are compelling, the researchers caution that more prospective studies are needed to confirm the impact of preoperative platelet counts and CBC-based ratios on PJI risk. So, what does this mean for you? If you're a medical professional working with morbidly obese patients, these findings could be pivotal in your preoperative assessments. Identifying high-risk patients could significantly reduce the chances of PJI and improve surgical outcomes. As always, continuing research is essential. Dr. Heckman and his team recommend further studies to validate these laboratory markers and refine our risk assessment strategies. That's it for today. Thanks for tuning in to this deep dive into the latest research on obesity and joint infection risks. Stay informed, stay healthy. See you next time.